Southern California, home to America's super fit and healthy. Americans spend more than any people in the world on health care. Yet the truth is, a decade-long survey conducted in 2000 by the World Health Organization ranked the United States healthcare 37th in the world, trailing most advanced industrialized nations. Colombia and even Morocco boasted better ratings than the U.S. Exorbitant drug prices and soaring treatment costs are the main problems, according to critics. Healthcare critic Charlotte Gerson, a sparkling 85-year-old and the picture of good health, adds that America's lack of disease prevention is also a problem. An author on health and nutrition, she founded the San Diego-based Gerson Institute, which promotes non-toxic treatments for degenerative diseases.
Oh, this is lovely. And of course, this is the famous apple carrot juice.
Part of a growing movement, she advocates organic diets and healthier lifestyles as an essential part of healthcare.
With a good nutritional approach, almost all, with very few exceptions, so-called chronic degenerative diseases are curable. We've proved it. Our so-called healthcare, which isn't healthcare but disease care, is one of the most expensive in the world and one of the least effective, ranks way down at the bottom. There are huge costs involved with doctors and with drugs, and some people spend a good portion of their income on drugs and on doctors.
The U.S. is the only major industrialized nation without universal health care. It has the greatest incidence of medical and prescription errors and has the highest emergency room waiting times. A 2002 study conducted by the University of California at Davis showed that among those surveyed, 90% of New York hospital emergency departments were overcrowded, as were 92% of those in Florida and 95% of those in Texas. Most patients were in the emergency ward because they couldn't get quick medical attention from their general practitioners. Moreover, millions of Americans cannot afford their medical prescription drugs. So in a globalized world, is it surprising that Americans are traveling abroad for health care? Dennis Hellingson has made a business as a medical tourist guide and driver. He started in a beaten-up station wagon several decades ago, catering to Americans wanting to visit Mexico, but too timid about crossing the border.
I've been doing this for 21 years, since '86, helping people get there. So that was a lot of years ago.
When he began, Dennis was driving to Tijuana twice a week, but that has changed with an increase in demand.
15 a week, and the average 3 or 4 a day. Sometimes it's a couple with somebody else, or 2 couples.
Despite U.S. medical industry warnings of substandard practices abroad, counterfeit medicines, and outright quackery, San Diego's red trolley to Tijuana is full of medical tourists looking for a bargain. A study conducted by the U.S. National Center for Policy Analysis found that an estimated 500,000 Americans crossed the border for surgeries in 2005. A majority traveled to Mexico and other Latin American countries. Americans were also among the estimated 1.5 million foreign patients who sought care in Singapore, India, and Thailand. For those Americans seeking healthcare in Mexico, San Diego is the perfect way station. A train from San Diego to the Mexican border leaves every 30 minutes. And more than 200,000 American medical tourists do go to Mexico annually. Frank Garcia from the state of New Mexico is here for low prices in treatment. He's one of 250,000 American men diagnosed last year with prostate cancer. An estimated 30,000 men die of this disease annually in the United States. The cost of treating the illness can be as high as $20,000 or as little as $1,000. Frank traveled to Tijuana after comparing cost of treatment at home in the United States to Mexico.
I got the opinion of my original doctor, and when I canceled the operation, he got mad. I want to know why. I said, well, I told him. And then he gave me, then he kept saying, well, you know, I could have done that. So my question was, why didn't you? No, he wanted $17,000.
Frank opted for the all-herbal Hoxsey treatment. Developed in the United States, it's one of the oldest alternative cancer remedies. But the American Food and Drug Administration banned the use of this treatment in 1960 after clinical trials failed to show that the all-herbal therapy produced any benefit in fighting cancer. So Americans now go to Mexico for this treatment. And Frank is pleased with his therapy.
I tried, I went to my, the conventional medicine there in New Mexico, and I was diagnosed that I had prostate cancer. And in fact, I was all set up to be operated on. I was scheduled to be operated on January the 1st of 2003, and in December the 2nd, we came down here. And they put me on the treatment, and like I said, 6 weeks later, my PSA dropped from 8.5 to 0.35, and I've been free ever since. I mean, I get the only thing I've got going now against me is old age, so I'm hoping they come out with a treatment that'll help that. I've sent a lot of people down here. I've given pamphlets, information.
Frank Garcia is just one of thousands of Americans traveling long distances to try such treatments in Mexico. Dennis has come to San Diego Airport to meet Ed, a retired 76-year-old school principal from Santa Clara, California. Unlike Frank Garcia and 47 million other Americans without health insurance, Ed's basic medical needs are covered. But he has his own reasons to get to Tijuana. He is in many ways emblematic of the global medical traveler. Stricken with prostate cancer, he can hop on a plane, cross the border, get the treatment he wants, and fly home, all in time for dinner, making many in the U.S. medical establishment wince.
In fact, I had heart surgery last June. I try to work along with a regular medical program because there are a lot of things that they do very, very well. But as far as this one aspect of my health, I didn't necessarily want to go through the rigors of chemo or surgery and all that kind of stuff.
Ed was diagnosed with prostate cancer 3 years ago and decided to treat it with a method banned in the United States. For good or ill, he left the U.S. for the freedom to choose his medical treatment.
When I first came down here was November of 2004. When I went to my local urologist, he said that he would want to do a biopsy. And that was the only condition he would treat me, would be if he could do the biopsy. And so I decided I'd like to try this option rather than go through the biopsies and maybe the radical procedures, whatever they may be. I just didn't want to go that route.
Ed decided to try an alternative cancer treatment, the Hoxsey therapy, which he had heard about in church. Many Americans are very aware that although the U.S. boasts among the highest standards of living in the world, many of their compatriots will travel abroad to get their teeth fixed and buy their vitamins and boxes of Viagra. Tom McAfee, chief physician at the University of California at San Diego Health Sciences Department, says it is a trend that is growing constantly.
And we're seeing more and more patients who travel around the world to get the health care that they need. And we even have some countries that are actually investing in creating a whole infrastructure that's designed to attract people who come for so-called medical tourism. I do think that the consumer has to be cautious. So I think for the consumer who goes abroad to get their health care needs met, they really need to do some serious due diligence to make sure that they're getting the quality of health care that they need.
Studies show that most Americans research their international medical options on the internet. Web pages give information on comparative pricing and biographies of the resident physicians at the various international medical centers. Emails, phone numbers, and U.S.-based contact bureaus are often listed. So all the would-be patients have to do is call a local number to get an appointment or set up a time for surgery. But some medical travelers still get information the old-fashioned way.
Word of mouth, word of mouth. The fellow that was in my congregation who went on the program, who came down here, was the one who clued me in. He said, well, you know, this is what I'm trying for my situation. And he said, I'm pleased with it. And he was glad that he came down, so he recommended, you know, this is an option. Of course, he's not going to give me advice. It was an option.